to everybody for joining us today.
Which one?
As some of you may know, Republicans in the House of Representatives passed their budget plan just a couple of weeks ago, and unfortunately, it would end the Medicare guarantee as we know it, slash Medicaid, and put Social Security at risk. It also continues to give tax cuts to the wealthiest and undercuts the progress that we've made in creating jobs and putting our economy back on the path to prosperity by cutting investments in education, innovation, and in infrastructure. You know, it is important that we focus on deficit reduction, but taking a cuts-only approach to reducing our deficit would be extremely harmful to our seniors, to our children, and to the most vulnerable. Democrats believe that we should strike a balance in our approach to deficit reduction, making sure that we ask everybody to pay their fair share, everybody to have a fair shot, and everyone to play by the same set of rules. Republicans don't seem to believe that. The Ryan budget would be devastating to seniors here in South Florida and across the country. It's a Republican path to poverty. They call it a Republican path to prosperity. We describe it as a path to poverty because it would pass like a tornado through America's nursing homes where millions of our seniors receive long-term and end-of-life care. The plan calls for fundamentally transforming Medicare from what is now a guaranteed benefit into a privatized voucher program for everyone currently 55 and younger. Now, rather than having guaranteed coverage of health care benefits, all seniors would receive a voucher to purchase private insurance or supposedly traditional Medicare. The voucher would grow more slowly than health care costs, which would force seniors to pay more. And over time, the amount that seniors would have to pay out of pocket would grow, and the share covered by the voucher would shrink. For current Medicare beneficiaries, this plan increases your current prescription drug costs by calling for the repeal of certain new benefits that you've been able to obtain through the Affordable Care Act. Republicans want to reopen the prescription drug donut hole, increasing the amount that seniors have to pay, that they already pay in the donut hole, and the out-of-pocket costs that you pay by up to $44 billion through the year 2020. And they also want to repeal the free preventative services that are now allowed through Medicare, once again increasing seniors' out-of-pocket costs by another $110 million just this year alone. This means, now listen, this is really important. I was aghast when I saw what this proposal meant for seniors. This means that the average senior would be paying another $6,000 out of pocket for the Medicare benefits that he or she currently receives. And it doesn't stop there. Private insurance would be trying to get the healthiest beneficiaries to join them, so that would leave traditional Medicare with just the people who are the sickest, which of course would drive costs up even more. And it would mean that if you're too sick or too poor to purchase private health insurance, you're left sort of twisting in the wind by yourself in traditional Medicare under the Ryan-Romney Republican plan. The Republican plan for Medicare goes back on the promise that we made as a country to the greatest generation, that after a lifetime of hard work, you'd be able to count on secure health care coverage. We also made a promise to your children that you wouldn't have to, that your children wouldn't have to go medically bankrupt, which, if you remember, before Medicare was adopted in the 1960s, so many children ended up going into medical bankruptcy because they weren't going to let their parents' health decline and not take care of them. That's simply an unacceptable direction. The Republicans want to take us backwards. They want to take seniors back to those days and younger people, and it's unacceptable. Now, I know that many seniors on Medicare in my district live on a fixed income, and that a large portion of that income already goes toward your health care costs. I really believe that there are alternative solutions for the best way for us to start to reduce the costs of Medicare. Cracking down on waste, fraud, and abuse, like the Affordable Care Act is spending millions doing, incredibly important. We know that we've been the hotbed of Medicare fraud right here in South Florida, and thanks to the Affordable Care Act, we've been able to crack down significantly on fraud. We've had the most arrests. We've been able to find the most Medicare fraud in terms of millions of dollars that we've ever been able to find. And we need to make sure that health care does not become reserved just for the privileged few. Our nation's budget, and I have the privilege of serving on the House Budget Committee, our nation's budget is a reflection of what we value as a country, what kind of future we want to build for our children, whether we honor our commitment to our veterans, and what kind of quality of life our seniors will have after years of hard work. The Republican plan ends Medicare as we know it, And it helps big insurance companies while putting the guaranteed coverage that seniors have earned and paid for at risk. And remember, you've paid for that your entire working life. At a time when our focus should be on investing in job security and job creation to strengthen the middle class and working families, the Republican budget continues to ensure that we have tax breaks for millionaires and billionaires, and to provide tax loopholes for big oil companies and big corporations. Rather than ensuring that everyone has a fair chance at living the American dream if they work hard and play by the rules, this budget makes arbitrary cuts that don't distinguish between wasteful spending and important investments that we need to ensure a prosperous future. 2 years ago, if you remember, President Obama signed into law the Affordable Care Act. And that was a game-changing law that is already giving American families and small businesses more control over their health care by reducing costs, increasing choice, and instituting common-sense rules. It also added 8 more years of solvency to Medicare, because we were able to work on reducing costs in Medicare, and that was without affecting the benefits of senior citizens. It has already saved Florida seniors more than $141 million in reduced prescription drug costs, and it provides important preventative services like mammograms and colonoscopies that are free of co-pays and deductibles. And as a breast cancer survivor, for me, early detection, I know, is the key. It's what made sure that my breast cancer was caught as early as possible. I don't want to only reserve that type of health care for young people. Seniors deserve it too. The Affordable Care Act will help 31 million uninsured Americans now be able to afford comprehensive coverage. It's already closing the Medicare prescription drug donut hole, protecting the doctor-patient relationship, and bringing down the deficit. In just its first 2 years, the Affordable Care Act, aimed at fixing our nation's broken health insurance system, has already helped millions of Floridians live healthier lives. And we're fortunate to have with us this morning Joan Gottman, who's here to talk about the difference that Medicare has made in her life and what changes to those benefits under the Ryan-Romney budget plan would mean for her. Joan?
Good morning.
Thank you very much.
Very proud to be here this morning. I am an 82-year-old senior. I had a stroke June 24th, 2011. And because we don't have the Ryan budget, I'm here today to tell you we have to see that it does not pass to keep me alive and going. It's my pleasure to be here, and I know that we're in very good hands. Thank you.
Thank you very much, Joan. Thank you. So, from